Assalamualaikum. My name is Nurul Najah binti Anas and my metric number is 072142. Today, I will present a case study titled When Border Closed, COVID-19 and the Strategic Fallout on Global Health Security. This topic doesn't just look at COVID-19 as a health issue, but as a strategic wake-up call to how pandemic shaped national security, military operation and global diplomacy. So, let's begin with a simple question. Why should pandemic matter in strategic studies? It is matter because global health is now recognized as a national security concern. COVID-19 shows us that viruses don't need visas. They move across borders faster than armies. And when health system collapse, states become vulnerable to internal instability, economic breakdown, and even geopolitical manipulation. Now, to the core of our case study. When COVID-19 broke out, countries rushed to close border, stockpile medical equipment, and secure vaccine. What did this trigger? First, health nationalism. Countries like the US and UK prioritize their population, leaving developing nations behind. Second, supply chain disruption. Malaysia faced delay in PPE, test kits, and vaccine ingredient. And the last one, military deployment. In Malaysia, the army assisted in enforced missing lockdown. In other countries, military hospitals were activated. Most importantly, it exposed how unprepared the global system was, even for predictable threats. COVID-19 reshaped strategic thinking in four major ways. First, national security policy now include pandemic alongside terrorism and cyber attack. Second, biopolitics and health diplomacy become tools of influence. For example, China's vaccine diplomacy in Africa and Southeast Asia. Third, digital surveillance increased in many countries, raising debate on privacy versus public safety. And the fourth, international cooperation weakened as countries act alone. This teaches us that pandemics are not just medical events, they are political, military and diplomatic flashpoint. So, what have we learned? Strategic readiness must now include pandemic preparedness. There is a need for stronger international cooperation mechanism like COVAX to ensure fair vaccine access. Countries must invest in health infrastructure, not just for public health, but for national survival. So, in conclusion, pandemic like COVID-19 are not once in a century shock. They are part of the new global landscape. For strategic studies, this means our focus must expand beyond guns and border. We must see virus as weapon, health system as frontline, and doctor as national defender. Thank you for listening. Stay safe and think strategically.